but babies this big don't fit through catheters this size. You know you did it right if you crush down on the instrument and white material runs out of the cervix. That was the baby's brains. You just affirmed her right to choose. For the first time in my life, I really looked. I really looked at that pile of body parts on the side of the table. And I didn't see her wonderful right to choose, and I didn't see all the money I just made. All I could see was somebody's son or daughter.
Pro-choice is a very controversial topic that is prevalent right now. As you know, there's a movement of people that are fighting for the right to make the choice. And I think it's something that we need to really focus and hone in on. And so I want to share this video with you. It is an ex-abortion doctor who goes into detail about the procedure and why he ended up getting out of that field entirely. And you need to watch this, check it out. I'm going to share my comments at the end. We'll get the mind of God about this.
Second trimester D&E abortions performed between roughly 14 and 24 weeks of gestation. Your patient today is 17 years old. She's 22 weeks pregnant. Her baby is the length of your hand plus a couple of inches. And she's been feeling her baby kick for the last several weeks, but she's asleep on an operating room table. You walk into that operating room scrubbed and gowned, and after removing laminaria, you introduce a suction catheter into the uterus. This is a 14 French suction catheter. If she were 12 weeks pregnant or less, basically the width of your hand or smaller, you could basically do the entire procedure with this. But babies this big don't fit through catheters this size. After suctioning the amniotic fluid out from around the baby, you introduce an instrument called a Sofer clamp. It's about 13 inches long. It's made of stainless steel. The business end of this clamp is about 2.5 inches long and 1/2 inch wide. There are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. A D&E procedure is a blind abortion, so picture yourself introducing this and grabbing anything you can blindly and pull, and I do mean hard, and out pops a leg about that big, which you put down on the table next to you. Reach in again, pull out an arm about the same length, which you put down on the table next to you, and use this instrument again and again to tear out the spine, the intestines, the heart and lungs. Head on the baby that size is about the size of a large plum. Can't see it, but you've pretty good idea you've got it if you've got your instrument around something and your fingers are spread about as far as they go. You know you did it right if you crush down on the instrument and white material runs out of the cervix. That was the baby's brains. Then you could pull out skull pieces. And you have a day like I had a lot of times, sometimes a little face comes back and stares back at you. Congratulations, you just successfully performed a second trimester D&E abortion. You just affirmed her right to choose.
Why did you end your practice of doing abortions?
I did over 1,200 abortions over a 4-year period in private practice, not counting the ones that I did during my training. I met my wife during my first year of training at Albany Medical Center. We got married about a year later and found that we had an infertility problem. After years of failed infertility treatment and several years trying to adopt a child, we were blessed with adopting a little girl that we named Heather in August of 1978. As sometimes happens in those situations, my wife got pregnant the very next month, and we had 2 children 10 months apart. 2 months short of my daughter Heather's 6th birthday, she was killed in an auto accident and literally died in her arms in the back of an ambulance. Anyone who has children might think they have some idea of what that feels like, but unless you've been through it yourself, you have no idea whatsoever. I know people find it hard to believe, but what do you do after disaster? You bury your child and then you go back to your life. And I don't remember exactly how long it was after my daughter died that I showed up at Albany Medical Center OR number 9 to perform my first second trimester D&E abortion. I wasn't thinking of it as anything special. This was routine to me. But I reached in, literally pulled out an arm or leg and got sick. You know, earlier on I described stacking up body parts on the side of the table. It's not to, gross people out, to use a simple term. When you do an abortion, you need to keep inventory. You have to make sure you get 2 arms and 2 legs and all the pieces. If you don't, your patient's going to come back infected, bleeding, or dead. So I soldiered on and finished that abortion. And I know it sounds, as I said, hard for people to believe, but I'm telling you straight up my experience. You know, after over 1,200 abortions, first and second trimester up to 24 weeks and all the rest of it, and being very dedicated to it, For the first time in my life, I really looked. I really looked at that pile of body parts on the side of the table. And I didn't see her wonderful right to choose, and I didn't see all the money I just made. All I could see was somebody's son or daughter. And I stopped doing late-term abortions after that, and several months later stopped doing all abortions.
Anyone that has a heart, your heart should be breaking right now after watching that video. I watched this video and I was trying to not bust out in tears watching this video, because this is crazy as he goes into these details about the procedure and everything that takes place in it. And just listening to his story about the reason why he made a decision to stop doing this is because he saw the value of life. Because here he is, him and his wife, they tried to have a child and they couldn't have children initially. And so they adopt a child. And then shortly after they adopt a child, they have their own. And he has to go through this trauma where he loses his own child and his child dies in his arms. And he has to go through this and then go back to work where he is normally, it's callous pretty much. He's callous to this procedure. He's been doing it for many years. And so most of the time it's like he's a robot. He's just going through it. He's doing what he needs to do his job. But now all of a sudden this time is different. He says he goes back and he's sick. He's sick as he's doing it. And because of how serious this procedure is, you can't leave anything inside of the woman, else she'll get sick and things can happen to her. And so here he is. He makes sure he gets out all of the pieces of this child, and he looks on the table, and what he sees is he doesn't just see body parts. He sees life. He sees a child, and it's heartbreaking. And this is something that before watching this video, if you were somebody who is fighting for pro-choice and leaning hard on that side of pro-choice, you've never seen this before with your own eyes. You don't know about the procedure. You don't know about the child. This man gives you a snapshot of what it is like. And I just pray that you would take this to heart and hear out what he is saying and what he is describing. Let it move on the strings of your heart to change your decision on what you view as life. You know, the Bible tells us that life, it starts in the womb. There are many scriptures in the Bible. God, he spoke to Jeremiah. He said, before you are in your mother's womb. And there are other scriptures where it talks about being formed in the womb. The psalmist talks about how God formed him in the womb. And so life, it starts in the womb. And this is something that you have to know, and you have to let that be a conviction that we can't continue to go down this direction. And this is a conversation that we really shouldn't be having this conversation in the sense of it shouldn't be something that we should be arguing on. This should be a no-brainer. But we have even Christians. My wife showed me or sent me a video the other day where there's a pastor that actually stands up and says that he's a pro-choice pastor. Shame on you, bro. Shame on you. That should not be the case. There is no case that you can build for taking the life of an innocent child and not giving them the choice of what they want. Because anybody, any human being that is born, we have a natural, innate desire. We want to live. Let the children live. Amen. If you enjoyed this video, do me a favor, hit that like button, subscribe, and share it to somebody else that you know. And then drop a comment in the comment section. Maybe you can help me get the mind of God on this one. And remember, we all have a mind, but there's no better mind than the mind of God.